The world has been quite fascinated by what's going on in Australia, I think because we contained it and then it's now kind of seeping out again.
A renewed surge in coronavirus cases has left officials with no other choice but to seal off the Victorian state from the rest of the nation.
At the end of June, we started to see cases rise. One day we had 10 new cases and then the next day it was 12. As those cases kept growing in Victoria, less of them were in returned travellers from overseas, which meant more of them were occurring in the community. And that's when the government decided to start implementing some stricter measures.
It's happening in Melbourne now. Of course, there's always the risk it could happen in other cities.
There's no rewind button. We just have to deal with the circumstances that we confront, and we all need to do it together.
Initially, there were 10 different postcodes that were locked down, and a few days after that, we saw some public housing towers placed into lockdown after a cluster broke out there. And then most recently, it's been announced that Metropolitan Melbourne is in lockdown. Now that represents a few million people. There's about 6.4 million people living in the state of Victoria. So pretty much it's a lockdown affecting most of the state.
They'll be obviously patrolling on the ground, but even using drones and aerial surveillance to stop anyone trying to get across. They will be trying to intercept anyone who breaks through that border.
We've also seen the border between Victoria and New South Wales close for the first time in 100 years. So it shows just how seriously the governments are taking this latest outbreak. A significant component was certainly the hotel quarantine program. So all international travellers returning to Australia going into mandatory hotel quarantine for 14 days. In other states and territories of Australia, that's been managed by police and Australian Defence Force personnel. In Victoria, security contractors were hired. Real questions have been asked of government now about, well, were these staff trained properly and what measures were in place?
How much training did you get?
5 minutes, yeah. And that was the PPE and everything, box and dice, and you were sent up to your level.
And it turns out that there was a breach in hygiene and infection control protocols amongst the staff. So the disease spread from a returned traveller to some security staff who then spread it into suburbs. That's now the subject of a government inquiry. We also know that there have been some outbreaks amongst families. So as Victoria eased its restrictions gradually, families could visit each other once again. So we think some clusters spread that way. There are all these different threads that are being followed, and certainly some people I've spoken to who are infectious disease experts say another element was just bad luck. There's definitely some discomfort that different people in different areas and different postcodes are being treated differently.
We can't go out for exercise, can't go out for work, we can't go get groceries and any essentials either. You can see police presence on every access point. It's scary.
They were given no warning. As the Premier of Victoria, Daniel Andrews, was announcing the public houses would be locked down, about 500 police were going in. For some residents, the first they learnt of that lockdown was either seeing it on the news or going to go outside and then being stopped by police.
There were reports of one bloke who'd taken one lot of his weekly groceries up to the apartment, coming down to get the rest out of the car, and police said, "No, mate, you've got to leave it there. Get back up to your apartment."
Was it really necessary to send in police first? Could you not have sent in community health workers first, for example? And why are public housing towers being treated so differently? It's really, really hard to say, but I think what we have to do is learn from it. We really need to learn about the virus from this. We need to appreciate how infectious it is. It is just so wildly infectious. I think it would be almost irresponsible at this point to lay blame exclusively somewhere, and I think that's how you create division. I think it can be really dangerous to start attributing blame without the data to back it up. What will really be interesting over the next few weeks is how do people respond to this second lockdown? How do people tolerate it? How do people take it? It's going to put a lot of pressure not just on people as individuals, but also on businesses. People overall, I think, are very aware of why this needs to happen, but I think it's going to take its toll.